Hi, everybody. Welcome to the 2020 Black Maternal Health Caucus Stakeholder Summit. Although I wish we could be together like we were this time last year, I'm so glad that you could join us virtually for the 2020 Summit, focused on passing the Omnibus and promoting the Black maternal health, promoting Black maternal health in 2020 and beyond. Last year, we hosted our Stakeholder Summit just 2 months after Congresswoman Adams and I founded the Black Maternal Health Caucus. The goal of that summit was to gather ideas to inform our legislative agenda and to hear other recommendations for how we should elevate the importance of the Black maternal health crisis in Congress. The proposals you shared last July and the subsequent conversations that we had on a range of policy ideas led to the development of the Black Maternal Health Omnibus Act, which I introduced in March with Congresswoman Alma Adams and Senator Kamala Harris on March 10th, 2020. Speaking of the Omnibus, I want to quickly give a huge thank you to our friends at Every Mother Counts, Ancient Song Doula Services, and other caucus partners. I was so thrilled, so excited to see the full page ad in the New York Times this weekend calling for passage of the Omnibus. And I look forward to hearing other ideas today on how we can advance the Omnibus in Congress, as well as your proposals for new policies to build on the ones that we included in that historic legislative package. But the Omnibus was not the only focus of the Black Maternal Health Caucus this past year. One of the recurring policy ideas that many groups discussed at last year's summit was extending postpartum Medicaid coverage from 60 days to a full year postpartum, a priority that Representative Robin Kelly has long championed. Over the past year, we've made unprecedented progress to advance this policy. In November 2019, the House Energy and Commerce Committee unanimously voted the Helping Moms Act out of the committee. And just last month, the House of Representatives passed the Patient Protection and Affordable Care Enhancement Act, which included this provision. These are historic steps. Extending postpartum Medicaid coverage is the single best thing that we can do to save moms' lives and tackle the glaring racial disparities in maternal mortality. And we've seen momentum on the Omnibus even more recently. On Thursday, the House Veteran Affairs Committee included my bipartisan bill, the Protecting Moms Who Served Act, in a legislative hearing, the first step in it becoming law. The Protecting Moms Who Served Act is an important part of the Omnibus that focuses on preventing maternal mortality and morbidity among female veterans. It's one of many provisions of the Omnibus that are critically important, especially in the midst of this pandemic. Other policies that have become even more urgent as a result of COVID-19 include investments in growing and diversifying the perinatal workforce and addressing social determinants of health like housing, transportation, and nutrition. We also know that this pandemic has worsened the mental health of American adults, exacerbating risks for prenatal and postpartum mental health and behavioral health conditions like depression, anxiety, and substance use disorder. The Moms Matter Act, a bipartisan bill led by Congressman Joe Kennedy, would make critical investments to improve maternal mental health with a particular focus on the unique risks facing Black women and other women of color. Introducing these policies and other bills in the Omnibus was a significant step, but we can't rest until we've gotten this legislation signed into law to ensure that moms can access the care and the support that they need and deserve before and during their pregnancies, throughout labor and delivery, and for the full year-long postpartum period and beyond. That's why today's summit is so important. Over the course of the next hour, we're going to hear from Black maternal health champions in Congress and some of the strong partners of the Black Maternal Health Caucus, including Dr. Jameel Taylor, Dr. Don Godbolt, Stacy Stewart, Jameel Fields Allsbrook, Aza Nadari, Angela Aina, and Jennifer Jacoby. Our speakers will describe the importance of the legislation we've already introduced, share strategies to get the legislation moving and get these bills signed into law, and propose ideas for additional steps that we can take to improve maternal health outcomes and reduce racial and ethnic disparities. I'm so glad that this event is being live streamed so that Americans all across the country can learn from all of you, the inspiring leaders who will be speaking today. I hope everyone watching the live stream will join the conversation on Twitter at our official account at BMH Caucus. Throughout today's summit, we're going to be tweeting out questions about the Omnibus, Black maternal health issues, your advocacy work, and other important topics. And we want to hear from you. So join us in the conversation and in this work. We can only get it done if we do it together. And with that, it's my honor to turn it over to my co-founder and co-chair and my friend, Congresswoman Alma Adams.
Thank you, Lauren. Congresswoman Underwood, thank you for those wonderful remarks and for reminding us of the urgent work that we're here to do. Congratulations to you, young lady, on the fine work that you are doing in the U.S. Congress. I am delighted to have the privilege of working with you. I couldn't have asked for a better partner in this fight. Good morning, everybody. I am Alma Adams, and I'm honored to represent the 12th District in North Carolina and to be the co-founder of the Black Maternal Health Caucus. And thank you all for participating and for tuning in to our second annual Stakeholder Summit on Black maternal mortality, the Omnibus, and the path forward. Over the next hour and a half, we'll dive into the root causes of maternal health disparities. We'll discuss necessary steps to improve outcomes for Black women, and we'll emphasize the role that our health systems and communities must play in ensuring that all women have access to safe, supportive, and healthy pregnancy and childbirth. And I am so looking forward to hearing from today's impressive lineup of speakers: Jameel, Dawn, Stacy, Jameel, Asa, Angela, Charles, and Jenny, many of whom have played an integral role in crafting the Omnibus. You know, I remember when I first discussed this idea of starting this caucus with my staff, and they said, "Oh, don't worry, Congresswoman, we're just building on the success of Black Maternal Health Week, and this will be a typical standard congressional caucus." But 1 year later, more than 100 members, and a 9-bill Omnibus package later, I think we can all agree that this has been no ordinary caucus. In fact, it's been quite extraordinary. And it's all thanks to you, our incredible group of stakeholders. Certainly, we appreciate your willingness to work right along with us. So thank you for your guidance, for your expertise, for your passion, for your commitment to improving outcomes for all birthing persons, mothers and babies, and especially Black moms and babies who remain our most vulnerable. You know, this work cannot be done alone. And we're so grateful for this amazing community fighting to save the lives of Black mamas and babies. Now more than ever, the pandemic has underscored the urgent need for everyone to have access to culturally competent and quality care. And as Reverend Dr. Martin Luther King declared in 1966, of all of the forms of inequality, injustice in healthcare, he said, is the most shocking and most inhumane. And as many of you know, the US is one of only 13 countries in the world where the rates of maternal mortality and morbidity are worse today than they were 25 years ago. And so we continue to have the highest maternal mortality rate among affluent countries because of the disproportionate death rate of Black mothers. Research also suggests that the cumulative stress of racism and sexism undermines Black women's health, making them more vulnerable to complications that endanger their lives and the lives of their infants. And to make matters worse, the significant health disparities that Black mothers and infants already face are further exacerbated by COVID-19. So Black maternal health in the coronavirus era is truly a crisis within a crisis. And for me, like countless others who are dedicated to this effort, this issue is deeply personal. And my focus on Black maternal health began when my daughter survived a complicated pregnancy that almost claimed her life and the lives of my grandchildren. So I knew when I got to Congress, I had to make this a priority. Black mothers are needlessly dying during what should be one of the most joyous times of their lives. And so at the same time, we have to be honest about the unique challenges that new mothers face. Childbirth can be a very lonely and uncertain time. So it's absolutely critical that we provide mothers and birthing persons the support they need before, during, and after pregnancy. And that includes access to nutritious foods and mental and emotional health services, quality postpartum coverage, a clean environment, including air and water. So we need to ensure that mothers have access to proper paid leave so We need to see it as an investment in public health and not as a handout. So thanks to last year's summit, we were able to craft the Omnibus, which builds upon these concepts and other existing maternal health legislation, making investments in training providers to screen for social determinants of health, diversifying our perinatal workforce, investing in telehealth and data collection. You know, not only do we target failures in maternal health care, but we propose solutions that are culturally competent, comprehensive, and effective. And so with the Omnibus, we've designed a roadmap to help our healthcare system, our health providers, our regulators and lawmakers and society to finally make Black maternal and infant health a priority. But our work's not finished, and we won't be able to get the Omnibus passed in Congress without your help. So I'm grateful for the ad in the New York Times. You know, a strong grassroots effort, and our dedicated stakeholders will continue to play a key role in advancing maternal health. So it's my hope and desire that today's summit and our breakout brainstorm sessions will help us to chart a strong path forward, both for advancing the Omnibus and for identifying any gaps and opportunities to strengthen the legislation. So thank you all for your commitment to this work. I'm going to continue to fight alongside you and to improve maternal health outcomes. We need to do this. But lastly, last but not least, I want to thank you for valuing Black bodies and Black lives. So let's not lose another Black woman, birthing person, or baby to this crisis. And I thank you very much. And let me just say, it is my pleasure now to introduce my dear colleague, Congresswoman Sharice Davids, who represents the 3rd District of Kansas, one of the first 2 Native American women to serve in Congress. She's been an incredibly supportive person of this work from the very beginning. And she is one who is leading one of the bills in the Omnibus. So thank you, Congresswoman Davids, and please take it away.
Thank you, Congresswoman Adams. It's always a pleasure to be able to join you and my other colleagues. And Congresswoman Underwood, appreciate your leadership on everything you're doing, especially for our freshman class coming into such a change-making class. It's such an honor to be able to serve alongside you. And first of all, I don't want to take up too much time because I know we all are really looking forward to getting into the weeds of how we make change here. But the first thing I want to say is that when I found out that there was a Black Maternal Health Caucus being formed, I was very much looking forward to joining the caucus and trying to figure out ways that I could be helpful and ways that I could help just be a good ally and try to make sure that I'm supporting the work that you all are doing. And, you know, these 9 bills in the Omnibus are really going to be super impactful. I could not agree more that this sort of thing happens because of the grassroots effort, the work from the folks who have spent so long trying to make sure that issues of Black maternal health are being raised and highlighted so that folks who are here in Congress and then even in our state lawmakers have an understanding about the devastating consequences of not investing in data collection, not investing in an inclusive health system that takes note of the really, it is, I can't use the word devastating more because it's something that should not be happening. We shouldn't have in this country worse outcomes for folks who really should have access to all the same healthcare. And I want to make sure to mention, I have included the data collection bill in this. And I think that when we get down to making sure that stories are being told and heard, it's my job as a legislator to do that listening. And I think we have now a whole lot of new lawmakers and folks who've been here working on this stuff for a long time who are pushing that, making sure that we take these stories, this data, and actually use it to implement change. And that change often will look like making sure mental and behavioral health is covered, making sure that postpartum coverage is extended, making sure that we're investing in paid leave, because these are the things that are going to be necessary. And that's all. I'm going to stop there because I really think that our time is better spent with me talking less and listening more. So thank you all so much for the work you're doing. Thank you, Reps Adams and Underwood, for all the work you've been doing in leadership. And I am so honored and privileged to be able to serve alongside you.
Thank you so much, Congresswoman Davids, for those remarks. Next up, we have Congressman Bobby Scott, Chairman of the Education and Labor Committee.
Well, thank you very much for to Elma Adams and Representative Underwood. They're both members of the Education and Labor Committee and do a great job. And this is just an example of the good work that they're doing. We knew that Black women had challenges in maternal health before COVID-19, and the numbers show it: low birth weight, infant mortality rate, maternal deaths. When I was in the Virginia State Senate, we passed legislation to address these problems by having special eligibility for under Medicaid for pregnant women. Outreach, we funded outreach workers, nutrition, and prenatal care. But now we see that COVID-19 is making it more likely that women will have need hospitalization and intensive care. And so we have to continue to make sure that we address this issue. Congress passed the Families First Coronavirus Response Act. In that, we provided free testing so that people could get tested without copays and deductible, and we had expanded emergency paid sick leave so people could address their problems without having to worry about their paycheck. We expanded virtual appointments through the WIC program so that people could get their WIC benefits without having to show up in person, making sure that they could remain safe. Almost 3 months ago, the House passed the HEROES Act. That included no-cost COVID-19 treatment for all healthcare consumers. It also provided subsidies to allow workers to maintain their insurance if they lost their jobs. We'd also know that because we want to make sure that you have consistent healthcare. You don't want to be switching policies in the middle of a pregnancy. And hopefully the Senate will respond to the HEROES Act this morning. We passed it almost 3 months ago. They're supposed to have a response this morning. But meanwhile, critical supports, including flexibility for the virtual WIC appointments, are nearing expiration. So I want to thank Representative Adams and Representative Underwood for your hard work in making sure that women get the support they need. This is a tremendous work, and it's just an example of your good work on the Education and Labor Committee. So thank you for all the good work that you do.
Well, thank you, Chairman Scott, for those remarks. Folks, this will be an interactive summit. And so get your typing fingers ready. For our first question, please share on Twitter, why do you or your organization support the Black Maternal Health #Omnibus? Use the hashtags Omnibus, BMHC Summit, and Black Mamas Matter. So please share your thoughts with us. Why do you and your organization support the Black Maternal Health Omnibus Act? Now, moving right along, first up in our line of experts, we have Dr. Jameel Taylor, Director of Healthcare Reform and Senior Fellow at the Century Foundation, who will provide remarks on the Omnibus.
Good morning, everyone. So awesome to see so many folks participating today, as well as being a part of this amazing panel with some very close colleagues of mine, as well as Representatives Alma Adams and Lauren Underwood. As mentioned, I'm Jameel Taylor, the Director of Healthcare Reform and Senior Fellow with the Century Foundation. I also serve on the Board of Directors for 3 phenomenal maternal health organizations: Mama Toto Village, Black Mamas Matter Alliance, and March for Moms. The Century Foundation is a progressive, independent think tank that conducts research, develops solutions, and drives policy change to make people's lives better. Addressing America's Black maternal health crisis is a priority for our organization. The Black maternal health crisis reflects, as well as reinforces, larger social inequities. The causes range from a biased and discriminatory healthcare system, to coverage and provider gaps, to the lasting impacts of slavery and institutionalized racism, all of which contribute to the high number of Black women who will die while giving birth or in the postpartum period. The COVID-19 pandemic has exacerbated these challenges. Because so many separate yet related things drive maternal mortality, so too must our solutions be intersectional and attack the problem at its roots from a variety of angles. This is why the Black Maternal Health Omnibus is so important. As the most comprehensive legislative effort to date to address almost every dimension of the Black maternal health crisis in America, the package of 9 bills would provide greater maternal health support in the following areas. First, it strengthens healthcare services and other supports for incarcerated women and supports maternity care coordination for women veterans. Second, it invests in telehealth with an emphasis on instructional training and programming for maternity care providers in underserved areas. Third, it establishes a maternal mental health and behavioral health task force to address prenatal and postpartum depression, anxiety, and substance use disorder with a particular focus on women of color. Fourth, it provides innovative payment models to incentivize high-quality maternity care and commissions a study on continuity of health insurance coverage for pregnant and postpartum women. Fifth, it ensures funding and resources for community-based organizations working on the front lines to improve health outcomes for Black women. Sixth, it grows and diversifies the perinatal workforce by establishing grants to start or expand programs for licensing and certification, and commissions a report to identify barriers facing low-income women and women of color who seek to pursue careers in maternity care. Seventh, it establishes a grant program to implement trainings on bias, racism, and discrimination in the healthcare system in honor of Cara Johnston. Lastly, it establishes a multi-sectoral and interagency task force to develop coordinated strategies to address the social determinants of health, and makes critical investments in these areas, including housing, childcare, transportation, and nutrition. The Omnibus helps fill many of the policy gaps that currently exist, focusing on mothers who are most at risk for pregnancy-related complications. It builds upon other critically important efforts, such as guaranteeing 12 months of postpartum coverage under the Medicaid program, improving rural health outcomes, and expanding midwifery and doula care. In the richest nation on earth, no woman should lose her life simply for wanting to be a mother. It's time to pass the Omnibus, dismantle racism and bias in the healthcare system, and make America a true leader on maternal health. Thank you.
Thank you, Dr. Taylor, for those remarks. Now for our second question, which policies in the Omnibus do you think are most important to improve Black maternal health outcomes? Please tweet your answers at BMH Caucus. Which policies in the Omnibus do you think are most important to improve Black maternal health outcomes? Now, next up, we have Dr. Dawn Godbolt, Policy Director at the National Birth Equity Collaborative, who will provide remarks on racism, not race, as the risk factor.
Thank you. Good morning to Congresswomen Underwood, Adams, and Davis, to the Black Maternal Health Caucus, and all the stakeholders engaged in eliminating maternal health disparities. I am Dawn Godbolt, the Policy Director at the National Birth Equity Collaborative, a mission-driven organization committed to improving birth outcomes for all people. I'm here today to talk about racism and not race as the root cause of the inequitable birth outcomes we see. When some people look at the statistics, they say, oh, Black and Native women are 2 to 3 times more likely to die from pregnancy-related complications or during delivery than white women. There must be something biologically wrong with Black and Native women, something about our darker skin that makes us more susceptible to disease. I would ask those people to look past our melanated skin to systemic racism as the root cause of health disparities, and specifically maternal health disparities. Systemic racism is a system of power that maintains the dominant social class. In the United States, systemic racism is woven through all levels of society, institutions and individual actions, policies, entities, our historical narrative, the very fabric of our society upholds white supremacy. And when we measure health or disparities, we see that the systems we've created leave some people behind to suffer in poverty, isolation, and to lack access to basic needs that are essential to building a healthy life. In the United States, compared to white women, Black and Native American women are more likely to live in poverty, have less wealth, live in hazardous conditions, and experience food insecurity, and lack access to health insurance and face barriers to prenatal care. The truth is, racism is ingrained in the medical field as well, particularly the practice of obstetrics. The father of modern day gynecology perfected his technique on enslaved Black women without consent or anesthesia. And the adverse maternal health outcomes we see today are in part due to the historical trauma of slavery, colonization, genocide, forced migration, reproductive coercion, and cultural erasure. There are many examples of this in our healthcare system and our maternity care system. Implicit bias can influence patient outcomes because it negatively affects interactions between providers and routine communication, recommended course of treatment, and options for pain management. The history of forced sterilization and infant separation policies has led to distrust between Black and Native American women and their care providers. Compared to white women, Black and Native American women regularly receive a lower quality of care, report discrimination from their healthcare providers, and report a lack of respect, autonomy, and choice during decision-making processes. Further, the lack of diversity in the birth worker field means that many women never have the opportunity to receive care from someone who looks like them. We don't have to live in a society where racism results in deprivation and death. Being Black is not a risk factor, but exposure to racism is. For too long, our policies and our laws have been racist. They create a social structure that is unwilling to acknowledge why some groups die at a higher rate. Despite all our wealth in the United States, our maternal mortality rate is higher than in any other high-income nation, and the rate is driven by deaths of Black and Native American women. And we cannot buy our way out of this reality. Black women who live in affluent neighborhoods, have access to health insurance and advanced degrees, are still more likely to have their babies die or die themselves than white women in poor neighborhoods with no prenatal care and no high school diploma. We also experience weathering, meaning our bodies age faster than white women due to the exposure to chronic stress linked to discrimination and racism over the life course, making pregnancy riskier at an earlier age for us. This is not about income, education, or insurance access. Another glimpse into the grim reality of health for Black and Brown people has been unveiled by the COVID-19 crisis and the data we've collected so far. Again, this is not about income, education, or insurance access. This is about a design flaw in America's systems and why it is so important that we advance the Black maternal health Omnibus. At the National Birth Equity Collaborative, we believe healthcare is a human right and that Black moms should have the chance to be Black moms. We ask that everyone support the anti-racist Black maternal health Omnibus and other anti-racist policies that will save Black and brown moms. Thank you.
Thank you, Dr. Godbold, for those remarks. Very, very pertinent. For our third question, how have you seen racism drive disparities in maternal health outcomes? Again, how have you seen racism drive disparities in maternal health outcomes? Now, next up, we will have Congresswoman Gwen Moore provide some remarks.
Thank you so much. It's really, really great to join this conversation. And even though I am a far past my years as a mother, I recall really the importance of this conversation from my own lived experience. And it informed me with regard to my joining the efforts of Representative Dr. Adams and our own RN Lauren Underwood in this critical work. I, in fact, gave birth to 2 of my 3 children at home, and it was a choice I made after finding that I did not get the kind of care that I thought I needed. And so I am really proud to join my sisters now in this maternal justice fight. You know, with COVID-19 right here at our door, the birthing experience for women has changed, and many of them are choosing to do what I did so many years ago, 40-something years ago, and to give birth at home. Currently, more than 1/3 of U.S. counties are maternity care deserts with no hospitals offering obstetric care and 0 obstetric providers. And this already adds to our high burden of maternal mortality among African Americans who are on the average 3 to 4 more times likely to die from pregnancy-related causes than white women. Certainly, Dr. Godbold, we should clone her and push her out to all of these hundreds of counties. If that were possible, we would perhaps not be in this crisis. Because that's the other element of it. To the extent that there are no OBGYN doctors, we're also lacking the cultural competent care that people need during pregnancy. And people do respond better to care that comes from people who kind of look like them, who speak their language, who live in their neighborhood. It ensures a higher quality of care. My bill, which was included in the Omnibus, the Perinatal Workforce Act, aims to address provider shortages, especially in underserved areas, by growing and diversifying the maternity care workforce of those who can support women throughout their pregnancies, labor, delivery, and the postpartum period. We need to continue these efforts, especially as our healthcare systems are strained and disparities are even more magnified because of COVID pandemic. This bill is just one way that we can do it. In the country, in the wealthiest country in the world, it is just egregious that we have third world data with regard to maternal health. And I think that expanding our workforce can greatly mitigate these problems. I think I have exceeded my time, but I'm just want to say I'm proud to be with you. I'm so glad of all of you who've joined us because this is a critical issue for our next generation. So thank you again, and I yield back.
Thank you, Congresswoman Moore, for those wonderful remarks. Now, next up, we have Stacy Stewart, President and CEO at the March of Dimes, who will speak on COVID-19 and Black maternal health.
Well, thank you all so much for inviting me to be here with all of you all. I'm Stacy Stewart, President and CEO of the March for Dimes. And on behalf of the March for Dimes, it's again my honor to be here at this summit, to be with Representative Underwood and Representative Adams. And thank you for your tremendous leadership. Also with Representative Gwen Moore and Representative Davids and Chairman Bobby Scott, my friend for many, many years, who many don't know has been a volunteer with the March of Dimes for decades and has been in the fight for maternal and infant health for many, many years. I want to thank him for being here, and thank you to all the stakeholders for all the amazing work that you all are doing. You know, I just want to touch on for a little bit, a few minutes, the issue of the pandemic and COVID-19 and what we're dealing with as a country. And I don't need to remind any of you all how stressful a time this is and how painful it is to see how it's affecting so many millions of Americans, and especially so many Americans of color. While we've been facing this issue of a public health crisis around Black moms and babies, now on top of it, we have a global pandemic that we have to address. And it's really having incredible effects on Black and Brown communities. We are seeing the disproportionate impact of COVID-19 on Black and Brown communities. We're seeing how so many vulnerable communities are being impacted every single day, how many lives are being lost unnecessarily, how many people with underlying health conditions are being disproportionately impacted by this pandemic, and how many more of us, people of color, have an increased risk of getting COVID-19 and an increased risk of dying from the disease. It is very alarming, and it is a big challenge now on top of the existing health crises we were already facing. We know that longstanding health disparities have put Black people at an increased risk of contracting COVID-19 because of the systemic health and social inequities that so many Black and Brown people face. So many of the racial inequities that Dr. Gottbold talked about are impacting all of us, all people of color, but it's especially affecting Black moms and Black babies and other moms and babies of color. In fact, the data has shown us that Black, Hispanic, and Latino, American Indian, Alaska Native people are dying at higher rates of hospitalization, dying of higher rates of COVID-19, or being hospitalized at higher rates. And we know this is having a big impact on pregnant women of color as well. We're still learning a lot about COVID-19. We're still collecting a lot of data around what exact impact it has on pregnant women. But what we're seeing so far really is alarming. Recent data findings released from CDC tell us that expectant moms with the virus had a 50% higher chance of being admitted to intensive care and a 70% higher chance of being intubated than non-pregnant women in their childbearing years. We also have seen out of studies from University of Pennsylvania, the data is showing that pregnant Black and Latina women are being infected at significantly higher rates as compared to white women. Even before COVID-19, the fact that 700 women die every year because of pregnancy and childbirth related causes, and more than 50,000 other women experience dangerous complications has been unacceptable. And our concern is that some of these outcomes will be made even worse because of the pandemic. Striking disparities exist among the health of moms, mothers and babies of different racial and ethnic backgrounds, which affects their likelihood to have chronic conditions and makes them more susceptible to complications from COVID-19, as the data has shown. The fact that, again, Black women are dying at higher rates disproportionately as compared to white women is a public health crisis. It already was, that demanded our immediate attention. It's clear that we have been, and we continue to fail Black women with respect to their needs during pregnancy, at the time of childbirth, and even after childbirth. We're failing to provide Black women with the necessary healthcare services that Black pregnant women need to ensure they have a healthy start to their pregnancy. We're failing them to identify those preventable pregnancy complications when they can be addressed, and we're also failing them at the time of postpartum to have a safe postpartum period, a postpartum period where they can enjoy being with their babies, surviving the postpartum period, both with their physical health and their mental health as well. And now COVID-19 has exacerbated this situation even more. And that's why the March Dimes so proudly supports and endorses the Black Maternal Health Omnibus. The package of legislation that has just been presented and we've talked about we think will have a significant impact on ending preventable maternal mortality and morbidity, and will close the racial and ethnic disparities by centering Black pregnant women's needs. We also strongly support bipartisan efforts to advance the Maternal Health Quality Improvement Act of 2019, that's HR 4995, as well as the Helping Medicaid Offer Maternity Services, the MOMS Act of 2019, which is HR 4996. It's clear that we still don't have enough data to accurately know the full extent of the risks COVID-19 poses to pregnant women, as the data CDC has provided to date has really been fairly limited. And we are missing many crucial pieces of information that we need, especially data on race and ethnicity, underlying health conditions, and other kinds of outcomes. We have to do a much better job to collect and uniformly report demographic data so that we can continue to learn how COVID-19 impacts pregnant women. And as efforts continue, and we've seen a lot of encouraging news about vaccinations for COVID-19, we cannot forget that vaccination and other therapies for COVID-19 have to address the need of pregnant and lactating women. Often pregnant and lactating women are often left out of these very critical trials. They are very much a vulnerable population. And too often when these kinds of therapies are developed, Black pregnant women, Black women, and women of color are often not included. And therefore, many of these vaccines and therapies often don't work for us because we were not included on the front end of the research. Without this critical information, we will not truly understand the efficacy of a vaccine. And we will not be able to ensure that the COVID-19 vaccine, when it's developed, is actually safe for all women, especially women of color, especially Black and brown pregnant and lactating women. So the March of Dimes is very committed and has been to a future where all women, Black and brown women especially, can have a healthy pregnancy. We certainly urge Congress to take immediate action on the maternal health legislation, the Omnibus that addresses the needs of Black pregnant women. We want to thank again all of the stakeholders and the members of Congress who led us to this place where we have a comprehensive package of legislation that is intended to address an existing public health crisis that, because of our pandemic, is probably only going to be made worse. So our sense of urgency around change and action is now. We believe that now is the time, and especially in advance of the November elections, that we should be calling on all members of Congress and those running for Congress to take a stand with respect to Black maternal health. 2 years ago, we launched a campaign called Blanket Change with 700 blankets on the National Mall to call attention to the needs of Black maternal health. Within a month, because of not just that effort, but many, many efforts of those on the phone, on this Zoom webinar, members of Congress, we were able to see a significant step forward in addressing Black maternal health with the passage of the Preventing Maternal Deaths Act. We need to now recognize that the time is now to take action again, once again, and pass even broader, more comprehensive and sweeping legislation that's represented in Omnibus to address the crisis that we face right now, especially in the midst of this pandemic. And so we're proud to stand with the members of the Black Maternal Health Caucus, all the members of Congress, all the stakeholders here to make sure we take a stand once and for all for Black and brown moms and babies, to make sure their lives are protected, are secure, that they have a long and healthy life, and that we can once and for all address this crisis that should not exist in the wealthiest nation in this world. Thank you so much.
Thank you so much, Stacy, and for your leadership at the March of Dimes. That call to action couldn't have come at a better time. Now for our fourth question, which policies in the Omnibus are especially important during COVID-19? What additional policy should the Black Maternal Health Caucus pursue to support pregnant and postpartum individuals during this pandemic? Now, next up, we're going to hear from Charles Johnson, founder of For Cara for Moms. Over to you, Charles.
All right. Good morning, everybody. Thank you so much for having me. It truly is an honor and a pleasure to be here with you all this morning. Thank you for convening this fabulous, fabulous, fabulous panel of experts and participants. And so I'm really just going to speak with everybody this morning from a survivor's perspective about what this Black maternal health omnibus means. And for those of you all who may not be familiar with my personal story, my wife, Cara, was exceptionally healthy and lost her life after what we expected to be a routine scheduled C-section at Cedars-Sinai Hospital in Los Angeles. She walked in and was allowed to bleed internally for more than 10 hours. So we begged and pleaded for the staff to take action. And our organization, For Cure for Moms, in addition to working closely with the leaders in Congress to advocate for these bills to support change and improve maternal health outcomes, we also focus a lot of our time, energy and resources in supporting the survivors and the families that have been impacted by this maternal health crisis. And so for me personally, every time we lose a mother, and I know that I speak on behalf of everybody that pours their heart into this work, it hurts. It hurts. And for me, and I've had this conversation with many of you on this call, it hurts because with all the work that we're doing, as far as we come, I always go back to what is it that we could have done more? What is it that we could have done to make sure that this mother's life mattered? And that she was seen and that she was valued and she was treated with the respect and the dignity that she deserves. And so furthermore, when we talk to mothers, the other thing that I constantly hear, particularly from Black mothers, is that they are scared, is that they are living in a perpetual state of fear of the outcome of their pregnancy. And many African-American mothers are consistently saying to us, I don't even want to get pregnant, or expecting women are saying, I don't even want to get pregnant because I am living in such fear. And if we really think about it, that is a horrible place to be. And so for these families of these survivors, what I want all of you who are on this call and on this meeting, who are on the front lines advocating, and our congressional leaders to understand is that this represents hope. So to be able to talk to these families and say to them that there are people that are fighting on Capitol Hill to make sure that your nightmare does not come to reality for so many other families, it means so much and it goes such a long way. And so what I want us to understand is, as we are going and we are doing everything in our disposal to push this Black maternal health Momnibus forward, it's important that we center this work and we focus on the statistics because they're horrible. But I really want us to focus on the individual stories, right? And understand that these women and these families are so much more than statistics. And I know that politics, quite frankly, is the art of compromise, right? But we don't have room to compromise. I can't tell Shimani Gibson's family that we have to compromise. I can't tell Amber Rose Isaac's husband that we're here to compromise. We have to remain resolute. We have to remain steadfast. But I am hopeful, more hopeful than ever, that this is going to be an issue that ends with our generation. I refuse for the issue of Black maternal health, mortality, morbidity to still be an issue when my children are ready to have children, right? And so for all of you all who are here, please continue to keep up the fantastic work. Understand that on behalf of my family and the thousands upon thousands of families that have been impacted by this maternal health crisis in our country, we are grateful. We are here. Those of you all who have worked with me know that anytime, any place you need me to speak out on behalf of these families, I'm here to support you, and understand that we are cheering you on. We are working and we're looking forward to making sure that these, all of these bills get passed and get passed in a timely manner. And I want to thank all of you so much.
Thank you, Charles. We, on behalf of Congresswoman Adams and Rep. Underwood, we have really enjoyed working with you, closely with you as well. So thank you for sharing those remarks with us today. Next up, we have Jameel Fields Allsbrook, Director of Women's Health and Rights at the Center for American Progress. She will speak on the intersections between environmental justice and Black maternal health.
Good morning. Thank you so much for having me here for this important conversation. Thank you particularly to Representatives Underwood and Adams for their foresight and recognizing the importance of creating such a space. And thank you to Charles for sharing a very heartwarming story. As was mentioned, I'm a director in the Women's Initiative at the Center for American Progress, which is a progressive think tank located in Washington, D.C. Our team focuses on ensuring women's health needs are at the center of policies related to health, economics, and broader public health. And I'll focus today on some of those broader public health issues. You know, while a lot of focus on improving maternal health is focused on the healthcare system, a person's health is impacted by a range of factors we all know. The so-called social determinants of health, including the food we eat, the conditions we live in, racism, and police brutality, all impact our ability to live healthy and full lives. In the interest of time, I won't try to cover them all, but I'll focus today on the environment and its impact on maternal health outcomes. Women of color, particularly Black women, are more likely to live and work near polluting power plants, in regions that are experiencing significant temperature changes, and in maternal health care deserts. As such, addressing these issues is key to achieving maternal health equity. First, in particular, addressing climate change is necessary. Extreme temperatures and particularly extreme heat can negatively affect maternal and fetal health outcomes because, among other reasons, people are at higher risk of overheating during pregnancy, following natural disasters like the ones we've been seeing on the news just yesterday in Texas. Women are at greater risk of experiencing miscarriages, preterm birth, and low birth weight deliveries, as well as intrauterine growth restrictions. Other possible threats to maternal health resulting from climate change include exposure to toxic chemicals, air pollution, water scarcity, and population displacement, which can impede access to prenatal care. Illustratively, a noteworthy example we're all familiar with is after Hurricane Katrina, there were higher rates of low birth weight and preterm deliveries. The hurricane also created mental health concerns, given pregnant women who survived the hurricane were more likely to experience post-traumatic stress disorder. Similarly, access to care was inhibited after the hurricane. 14 counties and parishes in Louisiana experienced a significant increase in percentage of women who received late or no prenatal care. Beyond climate change, there are other environmental issues which impact maternal health. For instance, lead-contaminated water can have a direct and adverse impact on maternal health, including adverse health consequences such as low birth weight, and can lead to premature birth and miscarriages. And Black communities, we know, have historically lived in homes with higher rates of lead. Just to give another example, all of us are familiar with, is that of Flint. Following that water crisis, pregnant people in that community experienced more low birth weight deliveries, decreased fertility rates, and there was an alarming high increase in fetal deaths due to the direct impact of lead-contaminated water, as well as maternal stress. And those problems persist today, as anyone in that community can tell you. Also, issues around air pollution is a particular concern for the Black community. African Americans face a 54% higher health burden as a result of air pollution compared with the general population, due in part to the fact that many polluting facilities are located in predominantly Black communities. Air pollution exposure has been linked with preterm birth and low birth weight, which can lead to neurodevelopment disorders in children. I say all of this to illustrate why it is important that we pass policies such as the Social Determinants for Moms Act, which is key to achieving the health equity. This act includes a number of provisions, including creating a task force to address social determinants of health, directing guidance from HHS around how Medicaid payments can be used to address those determinants, including air and water quality, establishing establishing a task force in HUD focused on moms, as well as a number of other policies. Even more additional policies are needed, and in the years to come, there will be a lot of work to undo many of the Trump administration's policies that have dismantled key protections related to the environment and related to climate. All of this is needed to ensure that the environmental and climate crisis does not continue compound onto the crisis that is presented by the maternal health crisis. Thank you, and I look forward to discussion more.
Thank you, Jameel, for those remarks. Our next question, get those Twitter fingers ready. What additional policy ideas should the @Black Maternal Health Caucus pursue to address the intersection of the environmental and maternal health crises affecting Black moms and babies? Now, next up, we have Aiza Nedhari, founding executive director of Mama Toto Village. She's a certified professional midwife and a family therapist. She will share with us today her thoughts on community-based advocacy for the Omnibus. Aiza, take it away.
Good morning, Councilwoman Underwood, Adams, members of the Black Maternal Health Caucus and the community at large. Thank you for allowing me to present before you today. So as we consider the necessity of translating policy to the Black community, the words of the great James Baldwin gives context to a history that presents an alternative view. He says, "I am not a ward of America. I am not an object of missionary charity. I am one of the people who built the country." It has been the peculiar historical standard to offer policy as a charitable act, a mere show of good faith, an olive branch to calm social unrest. The normative discourse amongst activists and within community is that the creation of policies for Black people in America have been at best performative, where the interests of policymakers converge with Black people during elections or a time of personal benefit. Community-centered design as a foundation for the creation of public policy has been a long-standing demand for Black people, marked by the phrases shouted by activists across the nation, "Nothing for us without us." Employing the community as partner removes the transactional relationship, lending itself to trust, shared power, and envisioning of upstream solutions that are culturally congruent, ethically sound, and reflect the needs of those most impacted. Dr. Ayanna Howard states, "Women have the unique power of being able to look at the world's problems and discover solutions that transform lives and makes the world a better place." While the women leading the Black Maternal Health Caucus embodied this truth, they answered the call. They took a wide lens approach to tackling this issue head on, while engaging the community with the desire to create what the formidable Congresswoman Maxine Waters says is good public policy in the best interest of the people. The Black Maternal Health Caucus fostered the conditions and the relationships for inclusive innovation through an intentional process that forged a new path for how to decolonize public policy by engaging the expertise of Black women while centering the voice of those working at all levels of this intersectional issue impacting Black maternal health. This caucus has exemplified how to move public policy from a place of community service to a community ownership. The moment of now, this instance of social unrest rooted in the longstanding fight for liberation, justice, and freedom, calls for greater transparency, accountability, and sustainable solutions across all systems, especially our health systems. The Omnibus legislation offers the opportunity to meaningfully engage the community and level power through information sharing. What is necessary to move the needle towards advocacy at the local level is translation. Too often policies live within the silos in which they were created, failing to offer community a mechanism to decipher the context and the contents. If we want the community to support or advocate for legislation, it must be accessible. Therefore, I recommend the following: that every bill is accompanied by a community brief, written in accessible language and structured to include background information, an outline of the main tenets of the bill and why this matters for them, meaning what is the articulated impact on the local and individual level. These briefs should be highly visual and available through multiple platforms. Doing this will provide community-based organizations and advocates with resources and talking points to facilitate community conversations, to galvanize investment in this legislation and build the grassroots momentum necessary to move this historic legislation forward. It also arms the community with information to weigh in on policies and practices within institutions of care and provide recommendations on a local level for systems improvement that impacts their lived experience. Additional recommendations are using social media to engage in a series of live chats on each bill, offering the community a chance to engage in civic discourse around this topic of Black maternal health, while also engaging around the contents of the Omnibus legislation. Continuing to use storytelling to document and share the impact that maternal mortality, morbidity, obstetrical and medical violence, and racism has on Black mamas, babies, partners, families, and communities, such as what Ancient Song Doula Services is currently doing in their Listen to Me Now. Creating a PSA on why the Omnibus legislation is the legislation for now, and continuing to use the media to center and amplify the intersectional issues highlighted within the Omnibus. This caucus has the opportunity to reimagine how we do policy now in the future. The Omnibus was the first step in that direction by taking a justice-centered approach to uphold the moral imperative to create the future for Black mamas, Black babies, and Black families we desire and they deserve. Thank you.
Thank you so much, Azza. Like you said, accountability and accessibility is absolutely key. Thank you so much for those remarks. Now, folks, for our sixth question, what steps will your organization take to build support for the Omnibus and help advance this legislation in the remainder of this year? What steps will you or your organization take to build support for the Omnibus and advance this legislation in the remainder of this year? Okay, now moving on to our next speaker, we have Angela Aina, Director of the Black Mamas Matter Alliance, who will speak on Black maternal health, data collection, and workforce investments. Angela, over to you.
Good morning. Good morning to all the members of the Black Maternal Health Caucus. I am Angela Aina with the Black Mamas Matter Alliance. First, I'd like to thank Representative Alma Adams, Representative Lauren Underwood, and Senator Kamala Harris for leading the charge in the development of the Black Maternal Health Omnibus. The Black Mamas Matter Alliance is a national network of Black women-led organizations and multidisciplinary professionals whose work is deeply rooted in reproductive justice, birth justice, and the human rights framework, in order to ensure that all Black mamas have the rights, respect, and resources to thrive before, during, and after pregnancy. BMMA uses the phrase Black mamas to represent the full diversity of our lived experience that includes birthing persons, whether they're cisgender women or gender nonconforming individuals, and all people of African descent across the diaspora, to include Afro-Caribbean, Black, and African immigrants' experiences as well. We recognize, celebrate, and support those who care for and mother our families and communities, whether they have given birth or not. We stand in solidarity with all Black mamas. At BMMA, we approach our work through the goals to change policy by utilizing the human rights framework to address health inequities and improve Black maternal health outcomes. We cultivate research that leverages community knowledge and Black scholarship. We advance care by promoting holistic, respectful, and comprehensive maternal and reproductive health approaches to Black mamas' care, and shifting culture to dismantle negative narratives on Black motherhood and amplify the voices of Black mamas. The Omnibus Act of 2020 presented 9 bills to improve Black maternal health in the United States through models of care, research, technology, and funding across all demographics of Black women. It has the potential to be transformative for Black maternal health because it goes beyond addressing maternal death and helps to advance maternal health equity. By centering Black women-led organizations like BMMA in the process, this package takes a proactive approach to addressing many of the systemic public health challenges, workforce development issues, and everyday experiences of Black birthing persons before, during, and after pregnancy. The causes of maternal mortality in the United States are complex and gaps in data persist. However, critical to the solutions of addressing the maternal health crisis in the US is the need to expand and invest in the Black maternal health workforce. The fact that over a third of US counties are considered maternity care deserts, where there are no facilities offering obstetric care services or have obstetric providers, points to the need to grow, expand, and diversify the perinatal health workforce. But this shortage of providers did not happen by accident. Historically, systemic racism, restrictive supervision laws, and discriminatory licensing policies forced midwives out of practice in their communities. Such policies have left a legacy of barriers and challenges that makes it difficult for future Black and Brown birth practitioners from receiving the necessary credentials in order to practice birth work in their local communities. While there is still more work to do to expand the opportunities to increase Black midwives in the United States, the Omnibus Act contains a few bills that serves as a first step in helping to address gaps in maternal health data collection and providing opportunities to expand the Black maternal health workforce. HR 6144, the Cara Johnston Act, calls for investments in Black women-led community-based organizations who work to advance maternal health equity. Of note, this bill will help support local programs that provide doulas and other perinatal health workers to women throughout pregnancy and up to 1 year after birth. HR 6164, the Perinatal Workforce Act, will establish grant programs to increase the number of maternity care providers and other perinatal health workers like doulas, lactation consultants, and peer supporters who offer culturally congruent care and are from the communities most impacted by the maternal health crisis. And HR 6165, the Data to Save Moms Act, builds upon the bipartisan Preventing Maternal Deaths Act by promoting greater levels of community engagement on maternal mortality review committees in states across the nation. The bill seeks to promote improvements in data collection processes, quality measures for maternity care, and supporting maternal health research at minority-serving institutions. The Black Mamas Matter Alliance encourages the passage of the Omnibus Act as it is greatly needed now, more than ever, as maternal deaths are increasing during this COVID-19 pandemic. Again, thank you to the Black Maternal Health Caucus for this timely summit.
Thank you, Angela, and thank you for your leadership at BMMA. We've been seeing some incredible engagement on Twitter, so please keep it up. Now for our seventh question, what are the largest gaps that you're seeing in maternal health data collection that we need to address? Now, next up, and actually with our concluding remarks, got Jennifer Jacoby, JD, Federal Policy Counsel at the Center for Reproductive Rights, who will close us out. Now, Jenny, over to you.
Thank you, Kishel. My name is Jennifer Jacoby, and I am a federal policy counsel at the Center for Reproductive Rights, a global legal human rights organization dedicated to advancing reproductive rights for all people worldwide. And it is my honor to give today's closing remarks. As we conclude this portion of today's summit, I want to thank Congresswoman Adams and Congresswoman Underwood for their leadership, the members of the Black Maternal Health Caucus, congressional staff, especially Jack DiMatteo and Kishel Williams, and all the members and advocates who presented and participated today. I am astonished at our collective power. Despite not being in the same room, we were together in every sense of the word. Together in this fight, standing firm in our purpose and our commitment to change. See, in this virtual room discussing a topic of pain and senseless loss, we still found ways to celebrate Black joy and honor Black brilliance. By coming together at this summit, we honored the giants we've lost. From the great Congressman John Lewis to our everyday heroes, Black and brown mothers who lost their lives while bringing new ones into this world. And so I am beyond grateful to be here with all of you today. So I've spoken to this esteemed group a few times before, and some of you might be familiar with my story. I am the product of a Black mother and a white Jewish father born and raised in New York City. I am also a new mother to my daughter, Sage. My story can be distilled to this. My family has experienced intergenerational trauma around Black birthing. And as we heard from Congresswoman Adams and Congresswoman Moore today, my family is not alone. See, 32 years ago, white doctors ignored my mother's rapid weight gain and sky-high blood pressure, making assumptions about her physical appearance steeped in racial stereotypes, and quite frankly, distracted about her marriage to my white father. My mother barely survived my birth, not because of her race, but because of racism, as Don Godbolt so aptly discussed this morning. And I recall my maternal grandmother, who is still with us today, Sage bearing her namesake, telling us how many Black women in her family died from childbirth or experienced complications. And this painful reality stretched back generations in Orangeburg, South Carolina. And 16 months ago, I shared in this unfortunate family tradition, bearing all the symptoms of preeclampsia, which went undetected, shouldering negative comments by providers as I lay on a hospital bed, hooked up to monitors and oxygen machines, praying for my baby and my own survival as my mother watched helplessly by my side. As I share this story with you today, this moment feels different, somehow more urgent and more important than ever before. So I promised Jack DeMatteo I wouldn't sing a line from Hamilton to try to lighten the mood after sharing this with you, but I would be remiss if I didn't at least make one tiny reference in my remarks. So for the Hamilton fans among us, you are familiar with the song, "History Has Its Eyes on You." And as I thought about my remarks today, I couldn't help but replay this song in my head because this statement is just so applicable to this moment. History has its eyes on you, on this nation, on this Congress, on this caucus, on the pandemic, on the movement for Black lives, on the national call for birth justice, on the very state of human rights. Now, I say these things not to overwhelm you, but to encourage you and give hope, because I know that this group is on the right side of history. Together, we can pass the Black Maternal Health Omnibus Act, a package brimming with critical policies that can save Black and brown lives, as Dr. Jameel Taylor explained. And through the expansion of the Omnibus and related legislation, we can overcome the challenges posed by the COVID-19 pandemic facing our communities, as Stacy Stewart discussed. And we can address other pressing, compounding issues like environmental justice, as Jameel Fields Allsbrook told us. We can achieve all of this and more by following the lead of Black and brown individuals and community-based organizations, as Aza Nedari and Angela Aina have shown us, and have led this work by such remarkable example. I have the fullest confidence in this caucus and its policies. Together, we will make the stories of our family's pain a thing of the past. Together, we will get justice for your wife, Charles, Cara Johnston, Amber Rose Isaac, and so many other moms. Together, we will forge forward unified, not distracted by colorism and other ill effects of racism that have infiltrated our communities as an attempt to divide us. Together, we will stand arms linked with our Native sisters in the face of medical racism as we fight for the right to bodily autonomy and basic human dignity. And we cannot and we will not stop until access to safe and respectful maternal health care is a reality for all birthing and postpartum people, no matter who you are, where you come from, what you look like, who you love, or how much money you have. We all deserve to be cared for with the utmost respect and treated as the experts of our own bodies during what is supposed to be the most incredible, joyous moment of our lives. I look forward to finishing this fight as we started 1 year ago together. Thank you.
Thank you so much, Jenny, for those powerful remarks and for appropriately and aptly tying together and weaving together all of today's speakers' remarks so beautifully. Thank you for sharing your personal story and intergenerational experience as well. And thank you again to all of our incredible speakers. For our final question today, in the remaining months of the 116th Congress, please share with us why it is so important that Congress pass legislation like the Omnibus to address the Black maternal health crisis in the United States. Now, for those of you who are joining on the live stream, please don't sign off just yet. We would like to share some special pre-recorded messages from other members of the Black Maternal Health Caucus with you, including messages from Congresswomen Barbara Lee, Elaine Luria, Catherine Clark, Kim Schreier, Sherry Bustos, Judy Chu, Mary Gay Scanlon, and Jan Schakowsky. We will also be sharing special messages from our stakeholders as well. Please stay tuned and continue to share your thoughts via Twitter, Facebook, Instagram, or wherever you engage on social media. For our stakeholders who are joining us currently on the Zoom webinar, it's now time for the breakout sessions. As Jennifer explained or shared earlier, the breakout sessions will be an opportunity for small group brainstorming. Each room has been given a session leader to help guide the breakout conversation. Everyone is encouraged to take notes and share them with Jack DiMatteo and myself, Kishelle Webster, following today's summit. You should have received a new Zoom link for the sessions, but if not, the link has been provided in the chat box here to the right of the screen. Go ahead and click that link. The rooms have been pre-assigned, and if you don't have a room, we will place you into one. So please go ahead and click the link and join us over in the breakout sessions. Thank you so much, everyone. Thank you for joining us. Thank you for being a part of this fight. And please enjoy these next few video messages.
Hello, I'm Robin Begley, CEO of the American Organization for Nursing Leadership and Senior Vice President and Chief Nursing Officer of the American Hospital Association. On behalf of our more than 10,000 member nurse leaders working in all healthcare settings, thank you for introducing comprehensive legislation to address the maternal mortality crisis, especially affecting Black mothers and babies in the United States.
Hello, I'm Selena Gore, the CEO of Women Heart.
Maternal health is a growing concern in the United States and in our African American communities. According to the Centers for Disease Control and Prevention, Black women are 3 to 4 times more likely to die from pregnancy-related causes than white women. And in Illinois, Black women are 6 times more likely to die. Black women in Illinois are 52% more likely to have a preterm birth, leading to further medical complications and risks. In the congressional district that I serve, Winnebago County has one of the worst preterm birth rates in the state of Illinois at 11.2%. These statistics are alarming. No mother should have to lose her life, and no child should have to lose his or her parent because of a pregnancy complication that we could have prevented. For these and so many other reasons, I'm a proud member of the Black Maternal Health Caucus, and I support legislation that will help Black mothers stay healthy during pregnancy and beyond. And I've also introduced legislation to fight the social factors that can lead to problems during pregnancy, such as good nutrition or lack of access to a prenatal healthcare provider. The majority of maternal deaths are preventable. It is vital we listen to Black mothers and give them the resources they need and they deserve. If we all work together, we can save lives and families.
Hello, I'm Congresswoman Barbara Lee, representing California's 13th Congressional District. I would like to thank Congresswoman Alma Adams and Congresswoman Lauren Underwood for their tremendous leadership in leading the Black Maternal Health Caucus to address one of the most urgent crises in the United States today. And yes, that's Black maternal health. I am so sorry I can't be with you today for the 2020 Black Maternal Health Caucus Stakeholder Summit, but I still wanted to share just a few words with you. It is utterly, yes, utterly unacceptable that Black women are 4 times more likely to die from preventable pregnancy complications than white women. We have a Black maternal health crisis in this country. The horror, and I mean the horror of health disparities for African American women is really, yes, in many ways, very personal to me. When my mother went into labor with me, the hospital refused her admission, and she nearly died as a result. By the time the callous people at the hospital agreed to admit her, they were forced to do an emergency forceps delivery. And yes, I bared those forceps scars, the scars of segregation and racism, above my eye until just, quite frankly, a few years ago. And so as a member of the Maternal Health Caucus, I am dedicated to using my role as a member of the House Appropriations Committee to address this crisis swiftly and with a firm resolve to turn the tide on the unacceptable disparities in healthcare plaguing the African American community.
Hi, I'm Mary Gay Scanlon from Pennsylvania's 5th Congressional District, and I'm grateful for the opportunity to be here today to participate in the 2020 Black Maternal Health Stakeholder Summit to address the United States' urgent Black maternal health crisis. The U.S. maternal mortality rate is exponentially higher than any other developed country, and Black women are 3 times more likely to die from pregnancy-related complications than white women, a glaring disparity that hasn't improved in decades. In our community, in the Philadelphia region, many organizations like the Foundation for Delaware County and the Maternity Care Coalition are addressing this crisis locally, but we must do more. I'm grateful to Congresswomen Lauren Underwood and Alma Adams and Senator Kamala Harris for their leadership in introducing the Black Maternal Health Omnibus this past March, and I'm proud to support their efforts. We must take a comprehensive approach to maternal health, and particularly Black maternal health, by funding community-based organizations, investing in social determinants that influence maternal health outcomes, and growing and diversifying the prenatal workforce. I urge my colleagues to support this important legislation to ensure the healthy outcomes that Black mothers and their babies deserve. Thank you.
Hi, I'm Dr. Kim Schreier, representative for Washington's 8th Congressional District. As a pediatrician, the health and well-being of children and mothers is paramount for me. In fact, that is one of the reasons I came to Congress, to make sure we could all access affordable care. And it's why I joined the Black Maternal Health Caucus, because we are seeing trends going in the wrong direction. We are seeing increasing maternal mortality and lower survival rates for African American children. This is why I've co-sponsored legislation to expand the Affordable Care Act, to expand WIC and also to expand Medicaid so that women are covered until their children are 1 year old. I'm also working on nutrition programs like SNAP. There is more work to be done, but that's why we have this caucus, because every woman and every child, every Black woman and every Black child deserves their best shot at life. Thank you.
Hi, I'm Congresswoman Elaine Luria from Virginia, and I wanted to start by thanking my colleague, Representative Lauren Underwood, for bringing us together today, as well as my other colleagues, to have this discussion on these very, very critical issues of Black maternal health. I think that all of us joining in this conversation today understand that the outcomes for Black mothers are far worse than for the rest of the country. And I really applaud Representative Underwood for bringing together a comprehensive package of legislation, the Omnibus, as it's been called, that really goes after determining how to approach and end these discrepancies in the outcomes of care for our Black mothers and children within the community. And I thank you for giving me a time to speak briefly today, and I'm very dedicated to continuing to work on this critical issue. Thank you.
Hello to all of the incredible advocates and leaders gathered today for the 2020 Black Maternal Health Caucus Summit. I'm Congresswoman Catherine Clark, and I'd like to start by thanking Congresswomen Adams and Underwood for bringing everyone together. We are all so grateful for your work to expand our understanding of the grave challenges faced by moms of color, and for your guidance as we work to improve their lives. I believe we all have to show up and help build the America we know is possible when we finally let equality, not power or privilege, lead the way. The fact is, pervasive and structural racism exists within our healthcare system. Women's access to quality care is linked to their race, socioeconomic status, and zip code. Black moms are 4 times more likely to die during childbirth than white moms. This is unacceptable, and nothing has brought to light the continued inequality in America's healthcare system more than the coronavirus. Black Americans are disproportionately suffering from the virus, and this extends directly to maternal health care. We're seeing increased pressure on birth centers, who are now receiving more than 6 times the usual number of inquiries as women seek out safe sites for labor and birth during the pandemic. Some hospitals are being forced to ask expectant moms to find alternative birthing locations. And it is critical that we do everything we can to support the birth centers that are taking on these additional delivery procedures. I am proud to advocate for policies that prioritize the urgent and holistic health needs of all moms and their children. And that's why I introduced the Babies Act. This legislation would make birth centers more affordable and accessible to Medicaid beneficiaries. If every mother has access to affordable, high-quality care in their neighborhoods, we would dramatically improve maternal health outcomes in more vulnerable communities. We must also do everything in our power to defend and strengthen the Affordable Care Act. The White House is in court right now, trying to dismantle what is a lifeline for so many moms and babies. A recent study that examined the effect of the ACA's Medicaid expansion provision on infant mortality found that between 2014 and 2016, infant mortality rates fell in states that had expanded Medicaid, while these rates rose in states that did not. In the states that expanded Medicaid, infant mortality for African American infants fell by more than twice the rate that it did in non-Medicaid expansion states. We cannot let this vital piece of our healthcare infrastructure and this tool to combat inequality fail. We must stick together and keep pushing for policies that help us recover and create a healthier, more just America. I know that none of this progress is possible without everyone gathered here today, and I look forward to partnering with you on this mission. We will not rest until all mothers and babies are healthy and safe. Thank you, and thank you for your partnership.
Hi, I'm Congresswoman Jan Schakowsky, and I am so grateful to all of you that you are having a summit to focus on the issue of Black women and maternal health. And so I am so thrilled to be one of the founding members of the Congressional Black Maternal Health Caucus, founded by freshman Representative Lauren Underwood from Illinois and Alma Adams. And it's so important because we put together all different bills, 9 of them, to really address this crisis. And together we had a press conference announcing it so that we would deal with these inequities that African-American women, Black women are facing right now. The other thing I wanted to thank you for, help that you gave us to pass Robin Kelly.
Hi, everyone. Just another reminder that the breakout sessions have begun. I believe we have about 30 folks still in the Zoom webinar. So please head on over to the breakout sessions. The link has been provided in the chat for you. And we thank you all so much for participating. We are looking forward to advancing the Omnibus this year. And with your help, with your support, with your guidance and leadership, we know that we can get it done. And so again, the breakout sessions have commenced. Please click the Zoom link to the right to join those sessions this morning. Thank you.
Hello, I'm Robin Begley, CEO of the American Organization for Nursing Leadership and Senior Vice President and Chief Nursing Officer of the American Hospital Association. On behalf of our more than 10,000 member nurse leaders working in all healthcare settings, thank you for introducing comprehensive legislation to address the maternal mortality crisis, especially affecting Black mothers and babies in the United States.
Hello, I'm Selena Gore, the CEO of Women Heart. We are a patient-centered organization that supports, educates, and advocates for women living with and at risk of heart disease. Heart disease can impact women before, during, and after pregnancy, and it is the #1 medical cause of maternal mortality. We know that heart disease and maternal mortality have a disproportionate impact on Black women, and we are eager to support policies that address these health disparities.
Greetings. I'm Howard Straker, and I'm president of the Physician Assistant Education Association. On behalf of PAEA, I would like to thank Congresswoman Underwood and Congresswoman Adams for their tireless advocacy as co-chairs of the Black Maternal Health Caucus. As part of PAEA's vision of health for all, our association is committed to supporting the development of a diverse perinatal workforce that is able to provide the high-quality care that all mothers deserve. This year, we've been proud to endorse and advocate for both the Black Maternal Health Omnibus Act and the Strengthening America's Healthcare Readiness Act. These bills would make critically needed investments in scholarship opportunities giving underrepresented minority students greater access to health professions education.
Hello, I'm Jenny Joseph, and I am the Executive Director of Common Sense Childbirth, Inc., and the founder of the National Perinatal Task Force, and the developer of a maternity healthcare model called the JJ Way. It has been my distinct honor to have been able to serve as an advisory committee member for the Black Maternal Health Caucus and the Omnibus Act. I am thrilled to see this legislation, and I believe strongly that it will make an impact on the safety, the quality, and the diversification of the workforce that we need so badly. In this time of the COVID-19 pandemic, it is clear that we must deploy all the tools that we have at our disposal to address these healthcare disparities, which must end. We must leave no mother or baby behind.
Hi, I'm Katie Shea Barrett. I'm the founding executive director of March for Moms. Thank you, Congresswomen Adams and Underwood, for your leadership in addressing the maternal health crisis in the United States. We want to offer 3 intersectional policy priority areas for your consideration today that are vital for improving maternal health, particularly for Black women. First, we need Medicaid reform. Women need to have health coverage through 1 year postpartum. Second, we need to support and scale evidence-based, integrated, and community-led models of care that center a midwifery model of care to seamlessly coordinate with mom's behavioral health care, primary care, and any specialty OBGYN care that she may need. Finally, we have to improve our data collection systems around maternal mortality, morbidity, and inequities so that policy change can be data-driven. March for Moms looks forward to working with all the stakeholders that are part of the Black Maternal Health Caucus so that together we can advance a policy agenda that is centered on the voices and the experiences of Black moms and families across this country. Thank you.
In the past year, Moms Rising has organized our over 1 million members to sign petitions urging their congressional representatives to support the Black Maternal Health Caucus Omnibus.
Hello, I'm Alice Turner, president of Lamaze International. We are honored to be part of the community supporting the mission of the Black Maternal Health Caucus. And we're pleased that many of the bills in the Omnibus currently include childbirth education. We believe that education can help families know what to expect during childbirth and most of all, establish a strong, informed voice during every stage of this journey. Our work towards reducing health disparities really focuses on education. We are educating our workforce on this topic, and just last week we co-hosted a webinar with the caucus on the role of education to reduce disparity and improve outcomes. And our Diversity and Outreach Committee is launching a scholarship program to diversify our workforce and in turn expand our reach. And as soon as we are able to provide in-person support for the Omnibus and the other work of the Black Maternal Health Caucus, our membership is ready to continue its advocacy work that has been a mission of the organization. Thank you.
Hello, I'm Allison Bovell-Ammon. I'm the Director of Policy Strategy for Children's Health Watch, a network of pediatricians and public health researchers committed to advancing health equity and improving the health of young children and their families by informing policies that alleviate economic hardships. We are proud supporters of the Black Maternal Health Omnibus package, particularly the Social Determinants for Moms Act. Pieces of this bill we have actively sought to advance, including holistically advancing health equity, ensuring access to safe, stable, and affordable homes for all families, reducing hunger and food insecurity, and promoting access to high-quality, affordable childcare. In addition to policies aligned with those in the Black Maternal Health Omnibus, Children's Health Watch also promotes other policies that have been shown to improve Black maternal health, including direct cash payments, enhancements to the Earned Income Tax Credit and Child Tax Credit, funding for energy assistance, and access to health insurance.
Thank you for inviting AMCHIP to participate in the 2020 Stakeholder Summit. As part of AMCHIP's strategic plan, we're focused on chasing zero maternal and infant deaths. In order for us to do that, we believe that we have to address the systemic racism that's impacting our health outcomes. And 2, any strategy that we apply must promote women-centered, community-driven, respectful, and equitable care. This past year,
A1 empowers and supports nurses caring for women, newborns, and their families through research, education, and advocacy. Addressing the Black maternal health crisis continues to be our top priority across all three programmatic areas. In this last year, A1 released education and clinical practice resources to better prepare nurses for providing new moms and their families with the care they need. Member nurses have been active by speaking to congressional staffers about the Black Maternal Health Omnibus Act and other bills to improve maternal health. A1 continues to research and develop guidelines and education for the nursing workforce so that every woman has a healthy birth.
Hello, I am Dr. Deborah Smith, a medical director at the Blue Cross Blue Shield Association. Collectively, Blue Cross and Blue Shield companies provide health care coverage to 1 in 3 Americans. And we commend the outstanding work of the Black Maternal Health Caucus in raising awareness and advancing solutions to improve health outcomes for Black women and their families.
My name is Dr. Chloe Zara, and I'm a practicing maternal fetal medicine specialist at Beth Israel Deaconess Medical Center in Boston. I'm also an active member of the Society for Maternal Fetal Medicine, an organization representing those of us on the front lines who are dedicated to achieving the best possible outcomes for high-risk pregnant people and their families. On behalf of the Society, we applaud the work of the Black Maternal Health Caucus to bring the needs of Black birthing people to the forefront of the national policy conversation and to advance legislation aimed at preventing maternal mortality. Since its founding, the caucus has made significant progress towards this mission, culminating in the introduction of the Black Maternal Health Omnibus Act this spring. The Society encourages the caucus to build on that progress by gathering wide support for the Omnibus, advocating for legislation to provide continuous coverage for all new mothers for 12 months after delivery, and prioritizing investment in both the research and innovative models of maternity care that will help us move toward equity in birth outcomes.
I'm Cincinnati Descancio of the National Partnership for Women and Families. I'd like to congratulate Congresswoman Adams and Underwood and the entire Black Maternal Health Caucus for your visionary leadership and groundbreaking action to solve one of our most alarming health inequities, the Black maternal health crisis. Today, we recommit to standing up for Black lives and supporting your work to achieve reproductive justice for all women. More personally, as a woman of color with my own barely made it out of childbirth alive story, I want to thank you for your dedication to this goal. We are at a critical moment of our history that will define us as a nation and determine our future shared prosperity. For over 400 years, women of color and their families have been in a state of practically permanent crisis. Our long history of racist and sexist laws and policies have inflicted deep inequities that the COVID-19 pandemic has laid bare and made worse. We are eager to continue working with you to demand urgent action to protect Black birthing families in COVID response bills and to pass the Omnibus package. Together, let's achieve a future where all Black women and their families don't just survive, they thrive.
Hi, I'm Brian Dittmeyer with the National WIC Association. We are proud to partner with the Black Maternal Health Caucus and grateful for the leadership of its co-chairs, Congresswomen Alma Adams and Lauren Underwood. The numbers do not lie. Black and Native women face disproportionate rates of maternal mortality in this country. Bold legislative action is needed to address this public health crisis. We strongly support the Black Maternal Health Omnibus, a series of actionable proposals that will ensure safer pregnancies.
But if you have some sort of digital technology that allows them to still receive optimal care, and it decreases the barrier of trying to commute into a health center.
Postpartum is the longest period. It's longer than that 40 weeks of pregnancy.
We need to pass the Omnibus.
And we need to pass the Omnibus.
We need to pass the Omnibus.
COVID-19 presents another dangerous challenge for Black women. That is why Johnson & Johnson is inspired, committed, and thankful to the work with partners like you and others across the healthcare spectrum to address racism, and health inequities in maternal care that have long plagued the Black community. Over the last 2 years, we have been diligently and passionately working on driving policy change to address the Black maternal mortality crisis in our country. And we are proud to be the only company to endorse the Black Maternal Health Omnibus.
The vision of our nearly 5,000 member hospitals and health systems is a society of healthy communities where all individuals reach their highest potential for health. Now, that vision cannot be achieved without ensuring the highest quality of health care for Black mothers and babies and putting an end to the maternal mortality crisis. That's why we support the work of the Black Maternal Health Caucus. We applaud the vibrant leadership of Congresswomen Underwood and Adams in developing the Omnibus.
Thank you again for joining us for the second annual Black Maternal Health Caucus Stakeholder Summit. We hope you enjoyed the program, and we look forward to working closely with you to advance the Omnibus Act before the end of this year. Thank you again, and enjoy the rest of your day.